So here I'm going to do the lumbar puncture for my patient. For that, initial part is that you're going to get the consent, talk to the patient, and let the patient know what you're going to do. And there has to be a reason why you are going to do this procedure, which should be explained to the patient. After this, you get the patient ready. I like to have my patient in gown because it gives me the liberty of the exposure and the cleanliness. And then I put my patient in the left lateral position. Naturally, you can do lumbar puncture in sitting position, and you can do patient in prone as well. But I like to do it in left lateral, which is easy for the patient as well. The key part of getting a successful lumbar puncture is your landmarks. So once you're going to start the process, you need to prepare the patient and put the landmarks on where you're going to put the needle in. So let me do this for you. So we all know at the level of the iliac crest, from both sides, you feel the spine, and that is the space between L4 and L5. So what I do is I put my thumb there, feel the sides, and with the pen, I don't mark with the ink. I just push it there and leave a dimple in the skin. Can you bring it closer? So it put a dimple on the skin. That's what I do. And I always go one space above. So that is in case I miss from the space which is routinely done, then I can go one space above and get my lumbar puncture. Okay. So and the key is that you ask the patient, clench the legs to the tummy as much as possible. Same way, the neck should be flexed and the chin should be touching the chest. So I got the Lidocaine injection. First I use the 30 gauge insulin needle to numb the skin area where the most painful receptors are. And I just try to infiltrate under the skin. Can you bring it closer? So what I do, I raise a bleb over there under the skin. So that's the whole point of doing this. So I initially clean the area with iodine, and after that, I clean it twice to prepare for sterilization. And after it dries up a little bit, I clean it with a clean gauze. I use spirit swab to clean it even more because iodine is CNS irritant. So we need to be careful before we put our needle in. Okay. Then I just let it dry and make the patient in the position. Let's make the position. And as we discussed, the most important key to position is head turned in and knees all the way to the tummy. Okay. So this is the good position, and I already have my landmark. Okay. So what I have to do is feel the space again. Okay. It may be because of the skin movement that my mark may move a little bit up and down, but I know where it is. Then after that, what I do, I put my 2 finger and thumb and kind of feel it. In transverse plane, also I feel the intervertebral space. So after that, I kind of have the idea where I have to put my needle in. And I always let my patient know, abhi sui aapko chubhti bhi mehsoos hogi. And there we go. And as you are going through the tissue plane, you can feel it. And again, do judicious infiltration so the patient don't feel pain during the procedure. Good. And I'll let you know. As it is a high volume tap, so I will use a 20 gauge. You can use 18, but it kind of ranges between 22 to 20 to 18 based on what you're trying to achieve. I again feel the side of the spine and the intervertebral space. And you have to direct the needle towards the head. As I hit the bone, I come back to the skin and direct the needle more up. There we go. Okay, so now we're going to check the opening pressure. Bring it on. So to check the opening pressure, this is the simplest way to do it. Let's go straight up. It's level. So you're going to keep it at this level. Yeah, pass down. And the level is over here. Thoda sa upar. Aise, bas. Okay. So let's see how high it goes. Okay. एक गहरा सांस लीजिए. Take a deep breath in and out. ठीक है. From 108 to 76. दोबारा गहरा सांस लें. Yeah. That's it. Thank you. Thank you. So, container to collect the sample. Sure. So, subtract 78 from 108. Ready. So you measure the opening pressure and then you take the CSF out for the routine labs and any specific labs you're trying to get. As this patient is a case of BIH or benign intracranial hypertension, we're going to take a little bit extra CSF to lower the CSF pressure. So you can see the clear flow of the CSF. In case the flow is not good, then you can rotate the LP needle and that will help steady the flow. So that's kind of my way of doing the lumbar puncture. You can see other demonstrations as well, and I hope with the passage of time you will develop your own way of doing it. So what's important is getting it done in an easy way so the patient's comfort is not affected. So we're gonna take out almost 20 cc in this patient